this fight against Ebola, which as of today became a military matter. As we said, up to 3,000 American military personnel will be deployed into this hot zone in Africa at a starting cost of $600 million. All of it to combat an outbreak the World Health Organization called today, quote, unparalleled in modern times. We get our report tonight from our chief medical editor, Dr. Nancy Snyderman.
The images from West Africa are searing. Children alone in the streets, men collapsed and left to die. With Ebola now spiraling beyond a health crisis and into a global security threat, President Obama said the United States must do more.
Ebola is now an epidemic of the likes that we have not seen before.
And so the administration announced today Operation United Assistance, sending 3,000 troops, including medical, engineering, and security forces, building 17 treatment centers in Liberia, shipping 10,000 sets of protective equipment and supplies, training healthcare workers, and assisting with security.
We've done it in Haiti several times. We've done it in South America. We've done it in Africa before. We've done it in Southeast Asia.
But this is an infectious hot zone.
That is unprecedented. And I can't remember a time when we sent troops to do this particular mission.
U.S. forces will not have any direct contact with Ebola patients, but they will be dealing with people who are scared and suspicious of outsiders offering to help. So the question remains, who's really in charge?
We've got the Russians, the Cubans, the Japanese, the Chinese, the Ugandans, the Europeans, the Canadians, all working on this issue. Who's going to take control?
The virus is spreading much faster than efforts to contain it. Researchers suspect the epidemic started last December with one case in Guinea. Now there are nearly 5,000 cases in 5 African countries. Some experts predict that if we don't get control of the virus, the number of infections could mushroom to nearly 55,000 by next month. Today, Ebola survivor and missionary Dr. Kent Brantley met with the president before testifying before Congress.
I witnessed the horror that this disease visits upon its victims. This is not simply a matter of providing humanitarian aid. It is very much a national security concern.
The death toll has climbed to over 2,500 cases, and if there is a silver lining in this epidemic, it may be that we're finally talking about a real commitment to improving fragile healthcare systems in West Africa and around the world. Brian.
A national security concern. That's
Yes,
the
sir.
takeaway quote. Nancy, thank you as always.